Very good morning to everyone. Today topic is vitamin B complex. So we will learn about the B complex. What is these vitamins? What are the important and what is the vitamins? So any idea what is this vitamin? Vitamin is an organic molecule that is an essential micronutrient which an organism needs in small quantities for the proper functioning of its metabolism. Essential nutrients cannot be synthesized in the organism, either at all or not in sufficient quantities, and therefore must be obtained through the diet. Now, what are the vitamins? Vitamins are of two types. Some are water soluble, the second is fat soluble. Water soluble is non-B complex, ascorbic acid vitamin C. B complex energy releasing vitamins like thiamine B1, riboflavin vitamin B2, niacin vitamin B3, biotin, pantothenic acid. And B complex is like hematopoietic also, like folic acid, vitamin B12. Others like B6, pyridoxine, pyridoxal, pyridoxal. Like these are the water soluble vitamins. And now, what are the fat soluble vitamins like vitamin A, retinol, beta carotenes, vitamin D, cholecalciferol, vitamin K, phytophenols, menophenols, and vitamin E, protophenols. Water soluble, thiamine, riboflavin, niacin, pyridoxine, biotin, folic acid, cobalamin, ascorbic acid, pantothenic. Fat soluble A, D, K. Thiamine, B1. What is this vitamin B1? It is biologically active form. Thiamine pyrophosphate (TPP) and also can have TTP also. Function, the main function is B1 is it is acts as cofactor in oxidative decarboxylation of the keto acids, TCA, tricarboxylic acid, amino acid degradation. RCC, acetic acid, COOH to RCOH plus CO. Other coenzymes also involved in the process. Sources like pork and vegetables like whole grains, legumes, tuna, so required daily allowance RDA is 0.5 mg per 1000 calorie intake or 0.1 mg per day. If it is deficient in the diet, leading to decreased ATP production, cell decreases, energy decreases, impaired cellular function, and the most important, very, very disease. Now, what is this riboflavin B2? It's called vitamin G also. It is biologically active form. Flamin mononucleotide FAN. Flamin adenine dinucleotide FAD. Main function of B2 is electron transfer, FMNH2, FAD2. The redox reactions, TCA glycolysis, etc. needed for good vision and healthy skin. The sources of riboflavin like milk, mushrooms, tomatoes, green leafy vegetables, and RDA for the children is 1.1 to 1.3 mg per day. If it is deficient in the diet or in the body, affects the growth retardation, arbophlavinosis, glossitis, very common feature in children. Soreness of the tongue, stomatitis is inflammation of the mouth and lips. Now, vitamin B3 is called niacin. It's selectively formed biologically NAD, nicotinamide adenine dinucleotide, and NADP. Nicotinamide really eliminated also thyroid. Function of niacin is coenzyme in the redox rates, TCA, fatty acid synthesis, gluconeogenesis, etc. DNA repair. Sources of niacin, unrefined grains, fortified cereal, meat, fish, tomatoes, mushroom, milk, liver, rice. Metabolism of tryptophan when amino acid is abundant needs riboflavin increases. What is this RDA? Required erosion and dietary erosions is 14 to 16 is needed and take. Niacin equivalent is equal to 1 mg niacin 60 mg. Deficiency pellagra affect of the Skin, especially rough skin, very common feature. And if it is taken more than requirement of the body or its toxicity, it affects also skin inflammation, heartburn, nausea, liver damage. Now vitamin B6, pyridoxine. Vitamin B6 pyridoxine, it is biologically active from pyridoxal phosphate, PN. Function main is coenzyme to transaminase reaction, especially amino acid. Decarboxylation of molecules. The sources of pyridoxine like wheat, corn, potato, banana, chickpeas, egg yolk, liver, fish. Daily allowance RDA is 1.2 deficiency causes induced by TB to a drug isolation supplement given, dermatitis, fatiguability, depression, confusion, convulsion, seizure, microcytic hypothalamic anemia, and epidemic very happened in 1950s. It's even more than the requirement of the body for its toxicity or most of the effect on brain. Neurological disorder, it is given more than 2 grams per day. Now vitamin B7 biotin, that's called biologically active form, binds to lysine residue of enzyme, function cofactor in carboxylation reactions, carrier of carbon dioxide, acetyl coenzyme A2 malonyl coenzyme A, synthesis of fatty acids, regulation of gene expression. Sources like almost all food, especially milk, egg yolk, tomato, almond, peanut, avocado, and mushroom. Also synthesized by intestinal bacteria. RDA recommended daily allowance is at least 30 mg per day. And deficiency causes deficiency does not occur naturally unless eat 20 raw egg whites per day. Protein available whites biotin irreversibly affects the body. Folic acid, biologically active form, tetrahydrofolate. Main function of folic acid is stimulates digestive gases appetite. Receive one carbon fragments from donors and transfer them into synthesis and nucleotides. Sources like green leafy vegetables, folates, organ meats, legumes, whole grain cereals. RDA, monthly daily allowance is 400 mg per day, more during pregnancy and obesity. Deficiency causes megaloblastic macrocytic anemia and failure. One's most common vitamin deficiency in US now caused by serious skin absorption inhibited by many medicines. So problem with the elderly. Now what is this covalent 12? Vitamin B12 coding system with O in center. One is a heterocyclic compound. It is the parent macroside related to substituted element that is found in vitamin B12. Name reflects that is the O. Function of covalent 12 is synthesis of methylmalonyl coenzyme A2 successful coenzyme. Degradation of odd chain fatty acid into tricarboxylic acid. Transfer of methyl groups produce red blood cells. Sources of vitamin B12 like cobalamin 12 like whole wheat, cottage, cheese, almond, clams, egg, pork, milk, etc. RDA is 2.4 mg per day and deficiency of cobalamin 12 caused by pernicious anemia and methyl malonic acidemia. MMA. What is this vitamin C? It's called ascorbic acid, very important one. Function in hormones, collagen, steroids, neurotransmitter, and bile acid synthesis. Essential for normal function of leukocytes, fibroblasts, and osteoblasts. Sources like citrus fruits, tomato, capsicum, green leafy vegetables, and breast milk. RDA in infants 30 to 40 mg, children 40 to 70 mg. Deficiency, scurvy, gum bleeding, petechial hemorrhage, painful, and swollen bones, and poor bone feeling, zero paralysis. In infancy, like anorexia, diarrhea, pallor, irritability, and increased susceptibility to infection. Diagnosis can make by X-ray of long bones that is seen as ground glass appearance with thinning of cortex, white line of Frankel, Treatment 100 to 200 mg of vitamins. Now, what are the fat soluble vitamins? Vitamin A. The retinol is predominant circulating form of vitamin A. Absorption and metabolism. Retinol is absorbed as free alcohol, while an active transport system contains a cellular retinol binding protein. That is called RBP. Yellow beta carotene requires bile salts for absorption and is converted to vitamin A in the intestine. Vitamin A stored in liver is retinal palmitate. Liver releases vitamin A to circulation through retinol binding protein and transport. Sources like carrots, the most important. Dark green leafy vegetables, squash, orange juice, fish liver oil. RDA for infants is 300 to 400 grams. Children 400 to 600 grams. Adults 750 grams. What is this physiological function? The rhodopsin is formed by the at the end of sun and transretinol, all transretinol, and that all transretinol is goes into the LPAP, and this RBS is between cyclosperm, retinal pigment epithelium, and it goes into the blood circulation in our now vitamin A deficiency. The formal chart is the classification is XN, that is night blindness, X1A, conjunctival gerosis, X1B, Bitot spot, X2, corneal gerosis, X3A and 3B. 3A is corneal ulceration, one-third involvement. X3B, keratomalacia, it is reversible condition, very dangerous. X3B is keratomalacia, is irreversible if it once occurred, very difficult to treat. And excess corneal scar and accept vitamin A deficiency causes Bitot spot, corneal geosis, corneal ulcer, and keratomalacia. What is the prevention schedule in emergency? In infant less than 6 months, oral vitamin A dose 50,000 once international. Infant 6 to 12 months, 1 leg international unit every 4 to 6 months. Children more than 1 year, 2 leg international unit every 4 to 6 months. That is prevention. And vitamin A dose is given for treatment of xerophthalmia immediately on diagnosis. Less than 6 months, 50,000 international unit. 6 to 12 months, 1 leg international unit. More than 1 year, 2 leg international unit. Following day, same age specific. Do at least 2 weeks later, same age specific. Okay. Now, what is this vitamin D? Vitamin D is a fat soluble vitamin, resembles sterols and structure and function like iron cholesterol. Dietary source like vitamin D2 plant and vitamin D3 animal. Here called calciferol is T2 derived from plant and called calciferol vitamin D3. In our body, vitamin D is also synthesized in exposure to the sunlight, direct sunlight. It is called also sunshine vitamin. So not strictly vitamin because it is in the skin against the criteria of vitamin. Dietary sources like fish, fish liver oil, egg yolk, non-veg. Fortified foods like milk, butter, other dairy products also. Etc. What is this RDA recommended dietary allowance is 400 mg unit to 10 mg per person. Countries with good sunlight like India 200 international unit or 5 mg per person growth, you can get directly from the sun. Absorption, transport, and storage. Dietary vitamin B absorbed by side fat soluble. In intestinal glucose cell incorporated in chylomicrons and enter in circulation binding. In circulation bind with vitamin D binding protein complex. Whatever it is synthesized in the skin also bind with D binding protein taken up by different tissues like liver and host tissue. So more than 90% is found by vitamin D binding protein. Less than 1% is free. So we get this already synthesized in the skin, saving the hydrocholesterol that is called calcium converted, and if it is absorbed Murder by liver, lactose 25, in presence of 25 hydroxylates, and bypass process of kidney by 25 hydroxylates, in presence of 1 hydroxylase enzyme that is converted to 125 hydroxylates and increase the calcium and phosphorus absorption. That very important role in regulation of the kidney. And in diet, vitamin D, the most important in presence of the sun, 70 hydrocholesterol is converted to cholesterol. That goes into the liver and 25 hydroxylase, 25 hydroxylase. There is genuine and the compound hydroxylase. Now, increase intake of vitamin D, that is called hypervitaminosis toxicity. Among the vitamins, vitamin D is the most toxic in oral. Leads to demineralization of the bone, increased calcium absorption for intestine hypercalcemia. Long hypercalcemia, deposition in soft tissue like kidney and arteries, causes calcinosis and store kidney cannula diabetes. Hypervitaminosis toxicity, that is very effective to the osteoclastic tissue. Renal weakness, that is called kidney causes renal osteodystrofia. Decrease 1 alpha hydroxylate, decrease synthesis of calcium in kidney, calcium phosphate mobilization defect, differentiation of the blood receptors. Vitamin D dependent lipids type 1, it is autosomal recessive disorder, mutation in the gene including renal 1 alpha hydroxylate, preventing conversion of 25D into 125D present during the first life. Classic feature of rickets including symptomatic hypocalcemia, they have normal level of 25D but low level of 125D. Same 50 to 70% of children presenting like alopecia more severe, alopecia areata, total is right. CRF, chronic renal failure, toxicity of vitamin D, decreased activity of 1 alpha hydroxylase. Hyperphosphatemia is a result of decreased renal excitability along with inadequate calcium absorption and secondary hyperparathyroidism. The rickets may be worsened by the metabolic acidosis of chronic renal failure. In addition, failure to thrive and growth retardation may be accumulated because of the direct effect of chronic renal failure of the growth hormone. X-linked hypophosphatemia repeats. It is X-linked, most common prevalence of 1 by 2 lakhs, 45. Sorry. X chromosome defective gene, female carrier very effective. So X-linked dominant disorder. Role in activating a phosphatonic or phosphatase in CA23 may be target phosphatase. Second, third is autosomal dominant hypophosphatemia lipids, less common mutation gene including HCl. And organ resistant to 125 hydroxyvitamin D3. Some vitamin D dependent type 2 rickets. Presentation is like vitamin D deficiency rickets 6 to 18 months and non-nutritional rickets beyond this age. Skeletal head, very common, craniotabes, delayed closure of anterior frontal and parietal portion, delayed eruption of the primary tooth, namely defects of carrier tooth. Shown in picture. Chest, rachitic rosary, Harrison groove, split infection, and lactasis. Like that. Seen in the picture. Back, scoliosis, kyphosis, lordosis. Skeletal manifestation, external enlargement of long bone around wrist and ankle. Bow leg, knock knee, anterior curving of the legs. Coxa vera, green, stick fractures, deformities of spine, pelvic, leg, rachitic arthritis. Lower extremities are extensively involved in familial hypophosphatemia. Upper limb more involved in the lower limb in hypophosphatemia. Like that, so picture. X-ray scene is like that. Investigation. Basic investigation to confirm whether it's serum calcium, phosphorus, and serum phosphatase. X-ray and long bone and middle wrist. Disappearance of provisional zone of calcification, widening, fraying, couple of the distance of south. X-ray wrist. Vitamin D level insufficient 10 to 20, deficiency less than 10, optimal 20 to 60 nanogram per ml, height 60 to 90, toxicity more than 90. The type of rickets and treatment, vitamin D deficiency rickets, we should give 6 leg intensivity every 2 to 3 weeks, IM 2 to 3 doses. It's tossed considered. VD rearmament, vitamin D dependent rickets 1, 0.25 to 1 microgram per daily only, and 2 total of 36 kilogram only with calcium supplement. If it's of prematurity, calcium we should give 100 mg per kg per day, phosphorus 50 mg per kg per day, vitamin D 50 mg per day. Prevention, premature twins and weak babies give vitamin D 800 units per day. Term baby and infant 400 international units per day. Those baby who cannot maintain daily supplementation inject muscularly vitamin D 1000 to 200. Calcium supplement is to give 0.5 to 1 gram per day for premature weak babies. Vitamin E, it is natural fat soluble antioxidant property. It is also called anti-sterility vitamin. Tocopherols and tocopherols. About 8 tocopherols, but alpha tocopherol is the most important secreted in the plasma, excreted in the bile by protein membrane like protein. The D is 0.4 gram per kg body weight per day for infants, premature infants 15 to 20 mg per deciliter, and sources like vegetable oils, corn, cotton seeds, safflower, margarine, leaf vegetables, fruits, and leaves. Vitamin E, very important, free radicals form vitamin D used for vitamin C, and this vitamin. Deficiency, very common in children like sterility, degenerative changes in muscles, megaloblastic anemia because of nucleic acid formation, changes in CNS, increase in erythrocyte free radicals, minor damage. Hypervitaminasis, least toxic among AB. Treatment, vitamin E should give when 5 to 25 mg, 3 mg alpha glucophosphorus in fats. Vitamin K is a fat soluble vitamin important role in coagulation of blood, so it is also called clotting vitamin. Fact its own natural synthetic form. Natural form of vitamin K, K1 phyloquinone and vitamin K2 midochlorium, while synthetic forms are vitamin K3 manidor and vitamin K4 manidor. Vitamin K1 is made by plant, while vitamin K2 is made by bacteria in large intestine. Absorption, transportation, and storage take place in intestinal presence of bile salts. The transportation from intestine is carried out through chylomicrons. Storage occurs in liver and from liver transportation to peripheral cells is carried out by the beta lipoproteins. Functions through a process called coagulation cascade. Vitamin K is needed as cofactor to activity coating factor like second prothrombin, 7 converted, 9 and 10 thromboplastin. RDA is in newborn 3 to 5 gram per day, 2 year of age group 5 to 10 gram per day, in older children 10 to 30 gram per day. Now sources of vitamin K is like cabbage, cauliflower, spinach, other green leafy vegetables as well as cereals. Vitamin K deficiency causes inadequate intake fat malabsorption into anticoagulant. Breastfeed, especially deficiency in breastfeed infants, it impairs clotting. Suspected diagnosis based on routine coagulation study finding a response to vitamin K. Vitamin K deficiency decrease level of growth hormone and other vitamin K dependent coagulation factor causing defective coagulation of the legs. Treatment healthy newborn should be 0.5 to 1 mg intramuscular and parenterally feed infants and children 1 mg vitamin K once weekly. Thank you.